What happens in the body when somebody applies a blood choke in BJJ? Why do we black out? Is it dangerous? And might you have a little accident in your pants? Watch this video to find out the answer. So in this Anatomy of a Submission series of videos, I explain exactly what's going on physiologically in the body in the various BJJ submissions, so you can have a better understanding of what's going on, maybe make a more informed decision on when you might want to tap, and also maybe use that information to apply the choke a little bit more effectively. Now, this is a very special edition of Anatomy of a Submission because I was training the other day and I blacked out from a cross-collar gi choke. Thanks very much, Oshan. I thought you might be a bit nice to an old guy, but at least you didn't kill me. So most of you will be aware that a blood choke is any type of choke that restricts blood flow to the brain by compressing the carotid arteries located on the sides of the neck. Now, depending on how you apply your submission, this could be from a triangle, it could even be from a rear naked choke, it could be from a cross-collar gi choke, that sort of thing. Anything that puts enough pressure on those carotid arteries to restrict or stop blood flow to the brain. So what happens when this type of choke is put on? Well, firstly, you're going to feel some pressure on the sides of the neck where those arteries are located, and this will be the beginning of the blood flow restriction. After this, you'll probably start to feel a bit lightheaded or dizzy. You might get that sensation of seeing stars or maybe getting that characteristic tunnel vision. And this can occur relatively quickly after the choke has been applied, only after a couple of seconds. If you continue to refuse to tap and that blood flow is further restricted, you'll likely begin to feel a bit disoriented, confused, or a bit mentally foggy. And some people report this as being very similar to when you're just extremely tired and start to nod off or doze off. You might even enter a slight dreamlike, or some people even report a slightly euphoric-like state. Now, at this point, the person may experience a very temporary state of paralysis or extreme muscle relaxation, and this is what normally causes the person to go quite limp or unresponsive. And yes, for those of you who are thinking it, this is the part where you may piss yourself. Around this same time, a loss of consciousness or blacking out will occur. Now, this can happen quite quickly, normally after about 5 to 10 seconds, depending on how effectively the choke is put on. And the reason it happens so quickly is because the blood requires a really constant supply of oxygen to be able to function. So if that supply is cut off, the entire system shuts down. Now, in terms of recovery, once the choke is released and the blood flow starts again, normally consciousness will be regained within a couple of seconds. Now, what's really interesting to me about blood chokes is that they don't necessarily hurt that much, particularly compared to other types of chokes or, shoulder locks or things like that. Now, admittedly, I'm quite an early tapper. I'm all about injury prevention, rolling harder for longer, that sort of thing. However, in this instance, there was no pain at all. So I didn't really sense any threat or danger. 1 second I was rolling and the next, my mate was rubbing my back, checking to see if I was doing okay. This was quite a bizarre experience for me. And when I've spoken to other BJJ players, I do notice a bit of a common thread of not wanting to tap to blood chokes because they simply don't hurt or feel particularly risky. This, of course, leads to the question of what are the potential dangers? If you black out from a choke, what might go wrong? So first and foremost, temporary loss of consciousness, blacking out, isn't dangerous in most cases. So unless there's some sort of underlying medical condition, the brain can handle a few seconds of hypoxia, oxygen deprivation, without any lasting effect. However, prolonged or repeated loss of consciousness can increase the risk of what we call hypoxic brain injury, where the brain cells begin to die due to lack of oxygen. This can lead to many things: cognitive impairment, memory loss, and other neurological deficits. Now, the amount of time this takes to occur can vary quite significantly, and the research does seem to be a little mixed on this, but a conservative estimate would be that this process of cell death would normally begin at about 3 minutes of oxygen deprivation. So you've probably heard of the rule of threes for survival. You can survive 3 weeks without food, 3 days without water, and 3 minutes without oxygen. Now, it's a very rough rule of thumb, but it holds generally true. However, there have been noted cases where this sort of hypoxic brain injury can occur from as little as 30 seconds of brain oxygen deprivation. So that's not really that long and perhaps a little close for comfort. So please, if you're rolling with guys from your gym and you think they may be blacking out, my advice is just let them go, put them on their side in that recovery position, get that blood back into their brain, and let them live to fight another day. Just one additional consideration I want to add here. If you are someone who has some sort of cardiac issue, perhaps you've had a stent put in, perhaps you've had open heart surgery, perhaps you've got high blood pressure, that sort of thing, this can increase the chance of some sort of longer term issue occurring. If you do BJJ and have some sort of cardiac issue, again, you're fine. You don't have to quit. You don't have to wrap yourself in a snug little blanket. However, I'd recommend when you start seeing those stars, getting that tunnel vision, that sort of thing, just tap early. It's probably not worth the risk of hanging on that extra bit of time. I hope you found that information useful. If you have any other submissions you'd like me to cover in this series, please leave them in the comments below. I'm here to help you train harder, for longer, and importantly, as pain-free as possible. To finally answer that all-important question, did I piss myself when I blacked out the other day? Of course, the answer is